All right, let's get into this. For a lot of people, Ayurveda just seems like this ancient collection of remedies, right? But what if I told you it's not that at all? What if, hiding in plain sight, there's a highly structured, super logical system, basically an algorithm for health? Well, today, we're going to crack that code.
Okay, so right off the bat, you can see this massive fork in the road, philosophically speaking. Over here, we've got the model we're all familiar with, the one drug, one disease approach. But on the other side, Ayurveda kicks things off with this principle, Purusham Vikshya. And what this means, at its core, is that a physician has to see every single person as totally unique. And listen, this isn't just some nice suggestion, it is the entire operating system.
And it's not just the approach that's different. The end goal is too. The Ayurvedic definition of health, which is called swasthya, isn't just about not having a disease. It's this idea of a dynamic, perfect balance across your entire being, which leads to a genuinely blissful state of your soul, your senses, and your mind. I mean, talk about a high bar.
So how are we going to unpack this? Well, we're just going to follow the logic. First up, we'll see why this approach is so radically personal. Then, we'll look at the diagnostic blueprint. After that, we'll map out the healing algorithm itself, decode its unique pharmacy, see why food is considered the ultimate medicine, and finally bring it all together with the personalized triad. So yeah, let's start right there with that foundation, radical personalization. Every single piece of this algorithm, from the moment you start a diagnosis to the final treatment, is built around one single crucial question. Who is this unique individual in front of me?
And of course, if you're going to create a personalized plan, you need really good data, right? Any algorithm is only as good as the information you put into it. And that brings us to the diagnostic blueprint, how this system actually gathers its inputs.
Now this is where it gets really interesting. The data collection happens on two parallel tracks at the same time. You've got Roga Pariksha, that's the deep dive into the disease itself. But, and this is key, you've also got Rogi Pariksha, the examination of the patient. The system absolutely needs to understand the illness, but it equally needs to understand the unique person who has it.
And this patient exam, wow, it is incredibly detailed. We're talking a 10-fold assessment that looks at everything from your core constitution, your Prakriti, to how adaptable you are, and even measures your psychological strength and, get this, your digestive power. This is the kind of deep, personal data that the whole algorithm runs on. Okay, so we've gathered all this data on the person and on the disease. So now what? Well, now we get to see how the system processes all that information into a logical step-by-step plan. This is the healing algorithm in action. And the sequence here is just so logical it makes perfect sense. Step 1, avoid the cause. The ancient texts are super clear. If you don't get rid of what's causing the problem, no medicine in the world is going to work. Step 2, actively break the disease process that's already in motion. And only then, once you've done that, do you move to step 3. Choose the right path forward. Now this choice of path, this is a critical decision point in the algorithm. It's a fork in the road. Based on all that data it collected about the patient, the system makes a call. Is this person strong enough to handle a really deep purificatory therapy? That's path 1, Shodhana. Or is a gentler approach needed to manage symptoms and build up strength first? That's path 2, Shamana. You see? The patient's individual condition dictates the entire strategy.
Okay, so let's talk about the tools you use for these interventions. The pharmacy. How does Ayurveda even understand what a herb or a substance does in the body? Because it's a totally different way of thinking from modern pharmacology, which is all about, molecules and receptors.
So instead of thinking about molecules, the whole system is built on a framework of 5 key properties. It's called Rasapa Panchaka, and you can honestly think of these 5 points as the master key that unlocks how any substance is going to interact with your unique biology. And this chart just lays it out so beautifully. It's a 5-point profile for everything. It starts with rasa, which is taste. Then you have its physical quality. Is it heavy, light, dry? Then a huge one is virya, its thermal effect. Is this thing fundamentally heating or cooling to your body? Then you have its post-digestive effect, and finally, any weirdly specific action it might have. Using just these 5 data points, the system can create an incredibly detailed functional profile for literally any substance.
And listen to this quote, because it gives you such a powerful mental picture of how these medicines are supposed to work. The problem is seen as an imbalance that's gotten itself stuck deep inside the body's tissues. The medicine's potency then acts like a wedge, physically creating separation between that imbalance and the tissue, which finally allows the body to get rid of it. It's a great visual, right?
So all of this brings us to what many of the classical texts consider the single most important tool in the entire toolkit: food. In this system, diet isn't just something supportive you do on the side. No, it is the primary intervention. Your kitchen is, quite literally, your first pharmacy.
This whole idea is captured in one really powerful phrase. Ahara, which means food, is Mahabhaishadya, the superior medicine. And the logic behind it is just so simple and elegant. Your body is a direct product of what you eat. Therefore, it follows that most diseases are, at their root, the result of faulty nutrition.
And the way this system thinks about food is so nuanced. It's not just about what you're eating. There are actually 8 different factors, and here are just 3 to give you a taste. How a food is processed, like roasting versus boiling, can totally change its effect. The combination of foods is critical. Some pairings are seen as really unhealthy. And even the habitat, where the food grew compared to where you live, can change how that food affects your body.
And here's a classic example to make this super real: combining fish and milk. Now in Ayurveda, this combination is considered a type of slow poison. Not because it'll make you sick right away, but because their potencies are seen as incompatible. And over time, that combination is thought to actually alter your body's tissues and lead to some really complex health problems down the line. Okay, so let's put all the pieces of this puzzle together. We've seen the personalized diagnosis, the logical treatment plan, the sophisticated way of understanding substances, and the absolute central role of food. It all comes together into one single cohesive strategy. And let's just remember the ultimate goal of this entire process. This algorithm is not designed to just put a Band-Aid on symptoms. Its whole purpose is to identify and treat the root cause of the problem, the underlying disease pathway itself, what's called the Sempropti. So after all that complexity, it all boils down to this simple but incredibly powerful formula, the Ayurvedic success triad. The entire system, the whole algorithm, is designed to do one thing: find the right drug for the right patient and combine it with the right diet. That is the personalized output of this entire process.
And that kind of leaves us with one final thought, doesn't it? If your health is truly a unique and complex equation specific only to you, does it make more sense to look for a standardized, one-size-fits-all product or a personalized algorithm that's designed from the ground up to solve for you?